Well, good morning, everyone. How lovely it is to be here. And I have to say thank you to this university from the bottom of my heart. I'm celebrating 46 years here as a lifelong learner, having picked up 2 bachelors, 5 masters, a PhD, and here I am again. So I heartiest thanks to all staff in the research and graduate school. I thank you from the bottom of my heart. It's just wonderful for us to have a PGR community here. Thank you so much. So, what am I doing today? Well, today, as you can see in the title, I'm looking at creativity in the community for health and well-being, especially social prescribing art on prescription. This is a huge topic, and it really drew me in because after I had received my PhD in online learning and teaching, which I shall show you at the very end as a little joke perhaps, but it's really rather interesting. And also uh, as a teacher in math, science and computing prior to receiving my PhD. And then, of course, I came into the world of art. What a magnificent world to explore. The Foundation Diploma in Art, the Foundation Art Diploma that was here in Treforest, and now it's in Nantgarw in Coleg y Cymoedd. And just amazing. Please, if anyone wants to take a year out for free, please go and do the Foundation Art Diploma. It's really absolutely amazing. Photography, ceramics, art, painting, drawing, printing, it's just wonderful. And it really is truly therapeutic. Now then, let's see where we go from here. So, the background to my study. My study really relates to society as it is today and society as it will become, because the stress of life, particularly during the pandemic, the isolation of people being deprived of visiting friends and relatives and communicating, as we saw with Helen's storytelling, extremely important for us to come together and use our creative knowledge, our creative senses. We all have it. Every one of us is creative. And so in 2014, when I was doing the Foundation Art Diploma, I stumbled across the all-party parliamentary group for health and well-being, which was chaired by Lord Howarth of Newport. And I thought, wow, this is something really, really important. We must look into this. And so I started reading, and I found some very good references and the legislation according to Health and Social Services, and also, most importantly, that the healthcare sector has a great opportunity to marry with the Arts Council and bring about creativity in our community. And Brandingham House is another very good reference, if you'd like to find that, on the kind of ways in which art does bring people to peace of mind, bringing people to understand their own body clock, very, very important, sleep, and also to use one's creative experiences in nature, go out and walk and explore, and keep your curiosity alive. And so social prescribing is here for doctors to help those who really feel they need more than medication, perhaps no medication. And so we go on from there. A wonderful study by Veronica Franklin Gould is such that she is looking particularly at dementia. Now, my son, Peter Rogers, who was here in the university, an alumni, Graham Henry's Lucid Prop for 18 matches for Wales, he is now looking at dementia, and he is in London at the university looking at the theory and contemporary practice for dementia care. And what is he doing? He's looking after patients through an agency and is hoping to present his own work and study in this respect. And he is finding that we must bring the community together. And in so doing, in bringing the community together, we all realize the significance of our health and well-being related to our own sense of creativity. So this model Oh, I am so indebted to my director of studies, Professor Carolyn Wallace, and the team with Stephen Smith, and also with Sarah Wallace, who is the most wonderful expert in the group wisdom software. And so looking at this chart, which I acknowledge, the social prescribing model in Wales, from Dr. Sally Rees and Professor Carolyn Wallace from the Life Sciences, the Faculty of Life Sciences and Education. I am so indebted to the research supervision team, and I feel that really truly through all the research I have done, I feel that I have really gained some insight to what research really means by doing this study. As you can see, there are many ways in which we can refer ourselves to some kind of social prescribing kind of activity, which could be a garden. We could go and join a garden club. We could go for rambles, therapeutic gardening, therapeutic art practice, creativity, photography, and so on. And it goes on. And so the methodology of the research, it relies on the group wisdom software. Now, group wisdom software is an amazing package for eliciting people's thoughts about a certain issue in society, in industry, in banking, in finance. Any area of our human existence can profit from researchers using group wisdom. So why is this? The research that I'm looking at the moment with using group wisdom is investigating the critical success factors for social prescribing art on prescription. And how does this software help us? The software helps us because it allows us to set a focus prompt. And the focus prompt is given to the participants in the research, who obviously have signed up on ethical and consider that they are involved in this practice in order to provide an evidence base for social prescribing art on prescription. So the focus prompt is, and if I ask you all, a critical success factor for social prescribing art on prescription is, if you want to put your hand up, tell me one idea that you have. At the back. Is there someone at the back who'd like to give us an idea? Yes, I think you would. Maybe you might say, thank you. Thank you. Thank you so much. Thank you. So this is how the brainstorming works. And we already have had online 80 participants. And from these 80 participants, we've collected 191 statements. Now, we have a problem here because the next section or the next activity for group wisdom software is the sorting process. And the sorting process is amazing. If you were all going to be participants in the sorting process, we would have to give you 191 statements to sort into piles. Now, that's a ridiculous thing to ask you to do. So we are at the process now. This is the second year of the research. We are in the process now of sifting through these statements with authenticity, because we don't want to lose any of the ideas. And so we're trying to eliminate repetition and reduce the 191 statements to 125. So that for the next online activity with group wisdom, which is sorting, everyone would have the list of 125 statements. What are you going to do with them? The software is asking you to put the 125 statements into piles or categories, and you each have the 125 statements. You can then go and label your piles. So for the research to be ongoing, the software will then analyze the names of the piles that each participant has given. And so we go then to an analytic phase, or the third analysis, which we haven't yet done. But it's very promising because this is just the simplified diagram. Okay, thank you, Professor. So this is a simplified diagram that some people might say, oh, well, it's important because the GPs need to understand what they can provide rather than perhaps give continuing medication. So the key aspects of the model are here. And again, I acknowledge Dr. Sally Rees and Professor Carolyn Wallace. I will move on a little bit from there. And then this is my pedagogical variation model. Now, when I go round, and I've been to Moscow 5 times, I've been to America several times, to Europe, and every time I show this diagram of my pedagogical variation model, everyone says, stop, Susie, stop, we want to take a photograph. So you're very happy. I would be very happy if you would like to take the photo. Now, why am I showing you this? I'm showing you this because the pedagogical variation model is made up of 2 matrices. They're called Boston matrix, and this is the Boston matrix for a learning aspect. The learning aspect for online is collaboration and change making. That is what social prescribing is doing, change making. So this model can very well be represented in a workshop for those facilitating workshops, that they can take on the kind of ideas that we can see here in the pedagogical variation model. What does it mean? We might have people that come along to a workshop that are very enthusiastic, very happy to be there. The doctors have prescribed it. Oh, I'm really happy that I've got a way out of my medication. Maybe I can go and learn something and do something and create something in a workshop. These are the Bs, collaborating together, exchanging their ideas. So we might get Bs in our workshops. On the other hand, we might get the foxes. Why are foxes different from bees? The bees collaborate. They can exchange and swap ideas. Very intelligent. Foxes also. So foxes intelligent, but they are unable, or they don't want to share the ideas, and they run away. Now, ostriches. Why on earth did the doctor send me here? It's nothing to do. I have nothing to do. I can't draw a line. I can't paint. I can't do any play work or whatever. And it's complete utter nonsense. I still need my tablets. No, there are ways of changing ostriches maybe to become tortoises. So what are tortoises? Tortoises are, oh, please, I'm not very artistic, but just give me a few things to do and give me lots of encouragement and I'll get there in the end. Now, this idea of bringing people together in the community for health and well-being, I ask you, is it really valuable? Thank you.